So the 17th question is, which of the following are the features of umbilical hernia in adults? So the first option is patients are commonly overweight. So yes, it is present in mostly obese individuals. So umbilical hernia is more common in obese individuals. Multiparous woman, and the patients with raised intra-abdominal pressure with a thin and attenuated midline raphe. So yes, in umbilical hernia, the linea alba or midline tissue becomes thin, stretched and attenuated. So the first option is correct. So first option is correct. Now second, most patients complain of pain due to tissue tension. So this is correct. There is a dragging sensation. So pain is dragging sensation. The defect is generally small, is often small, and contents get stretched. So second is also correct option. So 1 is correct, 2 is correct. Then third is, men are affected more commonly than women. No, women are more affected. So women are more affected, especially multiparous women and obese women. So third is incorrect. Third is wrong. Fourth, hernia repair can be done by the technique described by the Mayos. It is correct. So we do the classical repair is Mayos repair, which is also called as the double breasting repair. In which the overlapping facial layers are used. So fourth is also correct. So the correct option is 1, 2 and 4. So third is wrong. It is generally more common in women. Now coming to the references, so it has been taken from the Bailey's again. So the patients are commonly overweight with a thin and attenuated midline raphe. So the first option is taken from here. So this is correct. The bulge is typically slightly to one side of the umbilical depression, creating a crescent shape appearance to the umbilicus. Women are affected more than the men. So this is second option. So the first option is taken from here. Patients are commonly overweight with a thin attenuated midline raphe. Women are affected more than men. This is the third option. Most patients complain of pain due to tissue tension or symptoms of intermittent bowel obstruction. So another option is taken from here. In large hernias, the overlying skin may become thin, stretched and develop dermatitis. Now the treatment. Because of the high risk of strangulation, operation should be advised in cases where the hernia contains bowel. Small hernias may be left alone if they are asymptomatic, but they may enlarge and require surgery at a later date. Surgery may be performed open or laparoscopically. So coming to last option, open umbilical hernia repair. So the defects which are less than 1 centimeter, they may be closed with a simple figure of 8 suture. So if the defect is less than 1 centimeter, the treatment will be figure of 8 suture. So figure of 8 suture, or repaired by a Dahn technique where a non-absorbable monofilament suture is crisscrossed across the defect and anchored firmly to the fascia all around. So it can be repaired by the Dahn technique. If defect up to 2 centimeter in diameter can be sutured primarily with minimal tension, although if the defect is larger, the more tension and the more likely it is that the mesh reinforcement will be beneficial. The classical repair was described by the Mayo. So this was the last option, in which a transverse incision is made and the hernia sac is dissected, opened and its content reduced. Any non-viable tissue is removed, sometimes involving bowel resection. The peritoneum is closed. The defect in the anterior rectus sheath is extended laterally on both sides and elevated to create an upper and lower flap. The lower flap is then inserted beneath the upper flap and sutured to it, with the upper flap being brought downward over it. So it's a double breast technique. Double breast technique. So, as we have seen from the reference, first is correct, second is correct, and fourth is correct. Third is wrong because it is more common in women.